in the Department of Obs and Gynae at Camry Hospital, Banegutta Road. As we all enjoy the monsoon season after enduring such scorching summer days, we should be ready to face the surprises that gives in the form of mosquito-borne diseases during these rainy seasons, of which dengue is the most common and prevalent worldwide, especially in India. As we all know, dengue is caused by virus and it is transmitted by mosquito called Aedes aegypti. And Aedes aegypti lives in the water bodies like stagnant waters, like the stagnant water which we have in and around us, like coolers, empty coconut shells with water, and the flower vases. So we should take care of these stagnant water bodies and remove those bodies from in and around our houses. And also preventing the mosquito bites by taking few precautions like covering our body, wearing long sleeve clothes, and covering our legs when we go outside, using mosquito repellents and using nets at the night time. These are the few precautions that will be preventing the mosquito bite and thus preventing the transmission of disease. And especially those who are pregnant women, utmost care is taken care. Like general population, pregnant women are also at higher risk of acquiring this infection through mosquito bite. When pregnant women acquire this infection, the severity varies depending on the stage of pregnancy, like whether it's the early weeks of pregnancy or the later weeks, and also the immunity level of pregnant women, and also other comorbidities or the other issues like sugar, GDM, and gestational hypertension. These are the few conditions which alter the severity of the disease in pregnant women. So when you take the early weeks of pregnancy, when you acquire this infection, there is a chances of miscarriages. And during the second trimester, there is a chance that mid-trimester abortions or the preterm births and the low birth weight babies, further leading to risk associated with the preterm birth and the low birth weight in the fetus. And also, when you are acquiring this infection at the time of delivery, the bleeding manifestations are very severe that you can expect excess blood loss at the time of delivery. Last but not the least is the dengue infection can be transmitted to baby through placenta, which results in fetal and the neonatal dengue illness. So keeping this knowledge in the background, we go ahead to find out whether you acquired infection or not through observing few signs and symptoms. The symptoms like dengue fever has like 3 phases. The first phase is your febrile illness. That means like you will be having high grade fever along with headache, myalgias, sore throat, and you can observe rashes on your body, and there will be the excess vomiting. You can be mistaken these excess vomitings as the pregnancy associated vomitings. So every pregnant woman, when they are suspecting the dengue illness, has to be seen by doctor, and regular monitoring has to be done round the clock. So this is a period where the dengue infection is identified and treated, and thus prevent this infection at this stage and not to progress to the further critical level. That is where you have excess bleeding manifestations. If not taken care, might result in fatality. So what are the warning signs or the red flag signs that you have to look and seek the attention when you observe that you are in the critical phase? So you may be relieved from the fever. The fever can come down, but you should be constantly watching for the signs like the constant severe abdominal pain, feeling lethargic, and excess vomitings. These are the few flags and red flag signs that you should be observing. My message to all moms there: take proper precautions to prevent the mosquito bites, remove the water bodies where mosquitoes are grown, and thus prevent the infection and the transmission of infection. And be mindful, alert, and watch out for those symptoms, the red flag signs, and seek the medical attention whenever it is required. So to ensure the happy and healthy pregnancy. Thank you.